Every case we have had in MIQ recently has been the Delta variant of COVID. And Delta is surging around the world. While we cannot confirm it yet, we need to assume that our case will be too. And that has shaped all of the decisions we have made this afternoon. Public health officials have been working at pace this afternoon to gather information on the case and their movements, and I will pass to Dr. Bloomfield shortly to set out the facts as we currently know them, including locations of interest that have been identified so far. But first, I want to assure New Zealand that we have planned for this eventuality, and that we will now be putting in place that plan to contain and stamp out COVID-19 once again.
Yes.
Going hard and early has worked for us before. While we know that Delta is a more dangerous enemy to combat, the same actions that overcame the virus last year can be applied to beat it again. I'll now pass to Dr. Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So just to update you on the details around the community case that we announced this afternoon. To recap, just after midday I was alerted to a positive COVID-19 test result in Auckland. This case was identified when the person presented to their GP yesterday, Monday, with symptoms and was tested. So to start with, I want to thank both the person who has tested positive and of course the general practice. We can only act on cases if we know they are there as soon as possible. The case is a 58-year-old male from a household in Devonport on the North Shore of Auckland. He became symptomatic on Saturday the 14th of August, so the infectious period is considered to have started on Thursday the 12th of August. Importantly, and this has been fundamental to our advice to the government, at this point there is no obvious link between this case and the border. Whole genome sequencing is being rapidly carried out at ESR's Auckland laboratory for this case, and we expect to have the results through in the early hours of tomorrow morning. The whole genome sequencing will help us learn about this infection and whether or not it is confirmed to be one of the Delta variants we have seen overseas, and it should also give us information about potential links to other cases. You will be aware that every case that we have in New Zealand in managed isolation, the sample goes to ESR for testing, for whole genome sequencing. That's not always successful, but we have a database, of course, of all the previous ones that have been sequenced successfully. So it will help us with our source investigation. In the meantime, as the Prime Minister said, we are assuming this is the Delta variant, as all of the genomes sequenced over the last at least 3 weeks, and in fact all but one since late June have been Delta variant. The person lives with his wife, who was also tested yesterday, and yesterday returned a negative test. Both individuals have been self-isolating at home until this point. On their earlier movements, the couple travelled by private vehicle on Friday the 13th of August to Coromandel Township and stayed the weekend there, returning to Auckland on 15th of August. The case has a small number of workplace contacts who are isolating and being tested. The man is not vaccinated, but was in the process of actively booking his vaccination, had trouble with the website, but had been making efforts to do that. His wife is fully vaccinated. I do want to commend the case for being a frequent user of the New Zealand COVID Tracer app, and this tool has helped very much in helping us speed up identifying locations of interest. We have identified at last count 23 locations of interest, 13 in and around Coromandel Township and 10 in Auckland. I have 5 of those which I'll just run through now. These and any subsequent ones that are confirmed will be added to the Ministry of Health's website. These 5 locations are all around Coromandel. Importantly, the Star and Garter Hotel in Coromandel on the 13th of August between 6:39 and 7:40. The Umu Cafe in Coromandel on the 13th of August between 7:40 p.m. and 8:30 p.m. The Star and Garter Hotel in Coromandel on the 14th of August, that was the Saturday, between 7:11 p.m. and 9 p.m. the BP gas station in Coromandel on Saturday the 14th between 9:30am and 9:40am, and Terrace Beads in Coromandel on the 15th of August between 10am and 10:05am. The instructions for anyone who has been at those locations of interest at the time specified is to immediately self-isolate and call Healthline on 0800 3585 453 for advice about what to do. These locations and others will be on our website, as will be clear instructions about what people are required to do. Now, I should say that there will be people from outside of Auckland and